Really excited to be here today, particularly with my colleagues in government, Councilwoman Lynn Shulman, a good friend, longtime friend, nurse, and I think one of your daughters is actually a doctor. You know, I know they were in that profession. Yes, Mercedes Narcisse, my deputy mayor, Ann Williams Isom, also Councilwoman Rita Joseph, an educator. You know, just the council is just led by people who have been in the field and understand it. My good friend Dr. Mitchell Katz and the chief operating officer here at the hospital, Sheldon McLeod, and Dr. Fassan, who's taken over Department of Health and Mental Hygiene. Just an all-star team coming together to make this happen. And just two people I want to thank in particular. One, Dr. McMacken, who had the vision, and one person who's not up here that we just owe her just a debt of gratitude, Rachel Atchison, you know, a real star in the city. And, you know, this is a dream come true for her when she first, in 2018, brought this conversation of the possibilities of putting in place a lifestyle medicine clinic in H&H. People said it was impossible. And there was just so much pushback during the previous administration. There was just, you know, people just didn't get it, and people were afraid. And when we were talking about lifestyle medicine, they just thought it was not possible. But with the dynamic duel of Dr. McMacken and Rachel, we opened our first clinic and Dr. Katz, who was just open, and he just got it. We were just in the right place at the right time, and it landed us where we are now. So I'm really excited about this announcement today. And I just want to, before we even get into the announcement today, we want to just really give our hats off to our team in the COVID fight. As I was coming up and speaking with Sheldon, he was sharing with me, you know, the challenges we were having here, but the hospital held on and the hospital moved in the right direction. Sheldon, really kudos to you for, you know, just keeping the doors open during COVID, getting the staff together and making sure we were able to move forward. But today, the average positivity rate over the last 7 days across New York City is 4.52%, a huge win for the city. And another huge win, the daily positivity rate in schools is now less than 1%. Over and over again, we were very clear. We kept saying the safest place for our children is in a school building. And, you know, we went through a period when people were unclear on what we were doing. And I told my team every morning, ignore the noise. In government is filled with a lot of noise. If you know you're doing the right things and you're clear on your message, you need to stay committed to it. Parents woke up with clarity. I said my schools are going to be open. We're going to make sure they're safe. And parents did not wake up every morning figuring out what they were going to do with their children. We were committed, and the numbers prove we were right, that our children are in a safe place. Now, when they returned from the break, we were at 16%. And now we're at less than 1%. And that's a real congratulations to the parents and the people of this city and this amazing healthcare institution and the coordination that we put in place to make sure this happened. And so we want to continue to tell New Yorkers, get vaccinated, get boosted. That is why we won. 75% of all New Yorkers are fully vaccinated, an amazing feat. 85% of New Yorkers have at least one vaccine dosage, but we want to encourage and continue to do so. That is the difference maker here in the city. And so if New Yorkers all participate, we can get our city up and operating, and we're proud to do that. And so just focusing on where we are today and what we're doing and what we have in front of us. It's about a healthy lifestyle. And we made a promise that during my campaign trail, we're going to start rolling out all of the promises that I put in the universe when I ran. You're going to see them actualize. Promise made, promise kept. We stated we were going to expand on our lifestyle medicine clinic, and we're going to do that. We are fulfilling that promise, and today we are announcing the expansion of the health and hospital lifestyle medicine services to all 5 boroughs across the city, one of them here in Kings County. This is the most comprehensive expansion of lifestyle medicine in the nation. New York is going to change the conversation about using food not to feed healthcare crises, but to stop the crises, and in some cases, like my case, to reverse some of the chronic diseases that historically we said was not possible. And I think that it was clearly mentioned earlier by the Chief Operating Officer. He stated, we are happy to welcome this, to learn. Too many people are not willing to learn and evolve on what's the possibilities that are associated with living a healthier lifestyle. So these new sites will help patients who are living with chronic diseases. And we need to be clear on something. A chronic disease does not only impact the individual who has the chronic disease, it impacts the entire family. And everyone in this room knows someone who's going through a chronic disease if they are not going through the chronic disease themselves. That is what we must understand. A chronic disease hijacks your life, and it hijacks the life of your entire family. And that is why this is a significant moment on what we are doing. This clinic was based in Bellevue Hospital with Dr. McMacken. Now we're going to expand it throughout our entire healthcare system, a program that Rachel helped me champion when I was Brooklyn Borough president, and her whole family may be looking now and just saying, yay, Rachel. So these 6 public healthcare sites will provide full support for families and those who are going through the chronic diseases. And what type of diseases we're talking about? We're talking about heart disease, hypertension, diabetes, prediabetes, and all the other health concerns that's associated with obesity. We have a healthcare crisis that's not sustainable. And to be bold enough as a city and a hospital system to say we are going to do something differently is really commendable, and I just thank the entire team. This expansion is about helping patients make healthier lifestyle changes, including plant-based diet, physical activity, improved sleeping habits, and stress reduction. All the things that we must incorporate into our lives so that we can deal with the stress of being in a stressful environment. And the sites will provide support for people to stay on course, because it's very difficult to stay on course when you leave your home and all you see around your NYCHA facility is fast food, junk food. All you see in your schools is fast food, junk food. All you see in all of the places we feed people is fast food, junk food. Now we're saying we're going to give people choices so they can make smart lifestyle choices. And the sites will be providing expertise and professionals in the area to help people move in the right direction. It would give people the opportunity to come up with a real team to focus on how to live a healthier lifestyle. Nothing was more frightening to me in my professional and personal life than waking up without my sight in my left eye. And to be able to reverse that and going to all the doctors that's telling me my nerve damage, my vision loss was something I had to live with the rest of my life and take 5 medications, plus insulin and other medications for all the chronic diseases I was facing, not realizing that it was not my DNA, it was my dinner. And if I was willing to change my dinner, I was willing to change my destiny. And we're going to put the naysayers to the side and tell them, not only are we want to help your families, but maybe we will help you also as you deal with some of the chronic diseases that you're facing. And so we got it right. We're going to do it right. And New Yorkers will have trained lifestyle medicine professionals right here in the city to support them. Just as my mom, before the end of her life, was able to reverse her diabetes by going to plant-based eating as well, we're going to help the families, the moms, the dads, the children. We're going to expand this healthy lifestyle throughout our entire city. It's our goal to implement this in every part of our government. When you look at this city, 1 million New Yorkers are dealing with diabetes. More than half of the adults are overweight at 34%, or suffering from obesity, 22%. Heart disease is our #1 killer. #1 killer. And we could do something about it. And I know we could do something about it. And most importantly, we're here at Kings County because this issue impacts Black and brown New Yorkers the most, disproportionately. And it's time for us to stop feeding it. And so before I call the next speakers, I just want to respond to one incident that's just seemed to be running around. You know, my son said the other day, he said, "Dad, it's just amazing how the media just love following you no matter what. Does Eric eat fish? Does he eat a hamburger? Does he do this? Does he do that? Does he do this?" You know, I mean, it's just, listen, here's my message. The more plant-based meals you have, the healthier you are going to be. New Yorkers, don't beat yourself up. No one is perfect in this city. And if you look at a person who states, "I'm the mayor of the city of New York and I'm perfectly imperfect." So if I can be the mayor, then you can be the teacher, the engineer, and anything you want. Ignore the noise. Don't worry about what's on Mayor Adams' plate. Put these items on your plate. Because I'm living a healthier lifestyle. And I'm encouraging New Yorkers to have as many plant-based meals as possible because the science is clear. The more you eat plants, the more you eat fruits, the more you have a healthy lifestyle away from over-processed food, the healthier you are going to be. I know how I feel every day, and I want you to feel the same way every day. And so those who have questions on what I am eating, I'm over 18, and I know how to take care of myself. And if you haven't noticed, look at the pictures of yesteryears, and then look at the pictures now. I wear my suit so much better than I did 8 years ago. And if you like it or not, you have to say, yes, you do. So I want to now turn it over. You know, you maybe lose my place. You know, I'm going to turn it back over to you, our CEO, Sheldon. Thank you so much for allowing us to come in. We are really excited about the future.
Mr. Mayor, it's a hard act to follow. But I'll ask Dr. McMacken to come to the podium. Thank you.
Good morning. Thank you, Mayor Adams, for those extremely inspiring remarks. I was going to say you are always a tough act to follow, so here I am. I'd also like to thank Dr. Mitch Katz for his support, and as well as Mr. McLeod and the whole Kings County team for hosting this event in this beautiful space. Almost forgot I could do that. It's a little bit better. I could not be more proud of today's announcement that Health and Hospitals is going to be expanding dedicated lifestyle medicine programs to all 5 boroughs in New York City, including at Jacoby, Lincoln, Elmhurst, Woodhull, Gotham Vanderbilt, the original Bellevue site, and right here at Kings County. Expanding these programs and helping people adopt healthier lifestyles is really a critical priority for our city and for our nation. Studies show that we could prevent up to 80% of chronic disease and premature deaths simply by helping people eat a healthy diet, be more physically active, and not smoke. Up to 80%. But let's face it, it's not always easy for people to make lifestyle changes or to sustain them. We also know that many communities face significant barriers to being able to adopt beneficial lifestyle habits, including limited access to healthy foods, inadequate housing, and unsafe environments, among others. That's why our lifestyle medicine programs will not only provide individualized guidance and support tailored to each person's circumstances, but also partner with our social services teams and align with broader citywide efforts to address systemic inequities. 3 years ago, with the advocacy of then Brooklyn Borough President Eric Adams and the support of Health and Hospitals and Rachel Atchison, I had the honor and the opportunity to help launch the plant-based lifestyle medicine program at Bellevue. In this program, we use a specially trained team of doctors, a dietitian, and a health coach to help our patients transition to a healthy plant-based diet, increase their physical activity, avoid smoking, improve their sleep, reduce stress, and foster social connections. Sounds good, right? These evidence-based lifestyle behaviors can have a huge impact, not just on preventing and reducing the risk of chronic diseases like type 2 diabetes and high blood pressure, but actually treating these conditions, and in some cases, actually turning things around, just as Mayor Adams did. At the end of the day, it's really about helping people add years to their life and life to their years. I want to tell you the story of a patient who did just that. She was 65 when we met. She was living with severe obesity. She had type 2 diabetes, and she had a host of other medical problems. But what bothered her the most was actually the advanced arthritis in her knees, which had actually gotten so bad that she had to use a wheelchair outside of her house. And it was hard for her to go on trips with her friends locally, which was something that was really important to her. In our program, we worked with her to take small steps to incorporate healthy foods into her diet, foods that she liked and were accessible to her, and to increase her mobility, improve her sleep, and cope with stress. She kept building on those steps with our support, and over time, she lost 63 pounds, dramatically lowered her blood sugar and her cholesterol, was sleeping more, stressing less, eating a diet high in vegetables, fruits, and whole grains, and best of all, she was actually able to walk more than 2 hours with her friends. I can tell you that few things are more rewarding as a doctor than seeing your patients actually get healthier. That's why I went to medical school. And that's what we intend to bring to our patients and the communities that we serve. Thank you.
Thank you, Dr. McMahon. I'd like to bring to the podium Dr. Mitchell Katz.
Hey, thank you, Sheldon. Hey, everyone. As a primary care doctor working in the Lower East Side, I know how important it is to adopt a plant-forward diet and to take the other health improvements of exercise and stress reduction, sleeping well. My patients suffer from diabetes, from hypertension, and obesity, and often don't know that there's a way they can treat it without medications. And that turns out to be a message that a lot of people resonate with. We have an American culture where people think illness, doctor, pill. And that isn't always the best way. And people are fascinated. And it is, as you've heard, about education. I learned I take care of many monolingual Spanish speaking patients, and I speak Spanish, but I learned culturally there is no translation for brown rice in Spanish. It just doesn't exist. There's no, you can't translate it. You can say arroz integral, you can say arroz café. No one has any idea what you're talking about. They just look at you like you suddenly forgot how to speak Spanish. So concepts have to be translated, right? They have to be made culturally appropriate. But that can be done. Our mayor is a great example. I mean, he was talking about his diet. I like better that his press secretary recently tweeted that he can't believe that for the first time his principal has told him to take 6 deep breaths and go meditate. So this is a man who really lives this mission, who helps everyone else to adopt a healthier lifestyle. So in closing, I just want to thank, the amazing people at Kings County, my CEO Sheldon, my CNO Opal, and the amazing people at Kings County who save lives every day, but especially during these 4 cycles of COVID. Thank you.
Okay, thank you. Little problem we're having. Next up to the podium is Dr. Vasan.
Take this off. So we're at a unique moment in the health of our city, facing an ongoing, but slowly and cautiously improving outlook for the pandemic. COVID-19 has underscored that we must take a holistic approach to supporting the health of our communities. We're confronted with the underlying and structural health inequities our city has faced for so long, and that have been exacerbated by this health emergency we've lived in for the last 2 years. As the mayor said, heart disease remains the leading killer of New Yorkers. Diabetes is not far behind it. Obesity, especially childhood obesity, continues to rise. The burden of these epidemics, these chronic disease epidemics, have been borne disproportionately by communities of color, communities just like this one that Kings County has served so well for so long, the same communities that were most impacted by COVID-19. As my public health colleagues have said repeatedly, the pandemic is a portal, a window into underlying and intergenerational failures to serve all people equally, and a legacy of decades of systemic racism and neglect of certain communities, mostly black and brown. We must choose to walk through this portal and to use it as a call to action to address these underlying health inequities our city has faced for too long. These disparities in access to care, to healthy foods, healthy, nutritious, plant-forward foods, to green space for exercise, in education and in supports are not just core investments in prevention and public health, but they're very personal to me. My mother, an immigrant from Chennai, India, has had type 2 diabetes for over 40 years. Because of our relative privilege and access to care and support, she's controlled it well through lifestyle and nutrition and with a minimal reliance on medications. But my family in India are not so lucky. I have loved ones who have lost their vision, who've had kidney failure, have developed heart failure and other complications due to untreated or undertreated diabetes and other chronic illnesses. It's not lost on me the differences in their environments, their resources, and supports compared to my mother's. And as the mayor said, the impacts of chronic illness are felt, ripple throughout families and communities, and even across continents in this case, with each person impaired and each life lost to preventable and treatable chronic illnesses. So in order to begin to move the needle on cardiometabolic diseases and to save lives in the process, we're going to need every tool in the toolkit, from upstream policies to help make healthy food and lifestyle choices like exercise the easy and affordable choice, to regulation that works to limit the impact of calorie-dense, nutrition-poor food, to programs and incentives to end food deserts. The health department has been a leader in this work for decades, and we need continued and revitalized efforts in this space. But we also need fundamental changes downstream in access to and quality of care, and innovations that provide holistic supports attached to basic primary care. That's why it's so critical that we invest in and expand this program, like this Health in Hospitals Lifestyle Medicine Services. Increased access to dietitians, health coaches, and physicians will help support New Yorkers around how to reach their long-term health goals and give them the tools to actually do it. We know that one diet or one exercise plan will not fit everyone. That's why these individualized services are so key. And changes to health and lifestyle cannot be sustained on sheer willpower alone. It requires information, planning, and social support. Taking into account socioeconomic and cultural circumstances and other factors will help build sustainable success, which is why it's so important, so important that, and exciting that we've made a commitment to expanding these services through our flagship public hospital system so that New Yorkers who need it the most, coming from the communities impacted the most, they can benefit from tailored supports and services that for too long have been only accessible to people with greater economic means. As we continue to fight COVID-19, it's important to uplift these services that can address long-standing health inequities. So I applaud Mr. Mayor, Dr. Katz, Dr. Long, Dr. McMacken, and the entire Health and Hospitals team, especially the frontline health workers here and all over the city who do this work day to day and who have faced so much hardship over the past 2 years, for their leadership and commitment to this effort. The Health Department certainly stands with your effort and to improve the health of our city and to ensure access to innovative and life-saving care for all New Yorkers. Thanks a lot.
All right, we have time for a couple of questions on topic, and then we're going to move across the hall for a person registration. On topic, Amanda?
Yeah. Good morning, Mr. Mayor. How are
Good
you?
morning.
So this program, you had announced it in 2018 at Bellevue and then talked about how this program would get help New Yorkers. I think about 300 people have enrolled in this program so far with 850 on the waiting list. How do you see this program expanding? And with the use of telemedicine, what intersection do you see of getting people in to do this kind of programming while also keeping them in touch with how to keep with it through telemedicine? Can you speak more to that, please?
Yes, and I'm going to have Dr. McMacken talk to that. But if we go back in pre-COVID, there was a real battle for us to get telemedicine up and operated. There was a lot of pushback, but we were consistent. We stated that telemedicine was a tool that we should have used. Finally, the governor put in place to make sure reimbursement was in place. Brooklyn Hospital built out their system. We got others on board, and we were able to utilize telemedicine, and we're going to continue to move forward with telemedicine because it gives you an opportunity to check in on your patients, to communicate with them. It's a tool that we were reluctant to use, but now we're starting to use it. And people looked down on us when we first talked about telemedicine. But Dr. McMacken can talk about the program we had at Bellevue and the expansion that we are putting in place.
Thank you, Mayor Adams. So, yes, we've served hundreds of patients at Bellevue, and the number just keeps growing. And we have seen, as you pointed out, a huge demand for our services. And so it's really showed us, as was alluded to earlier, how much people really want this support and this guidance. And so that's why we're so excited to be able to roll it out to all the boroughs and reach more communities. What we have seen throughout the pandemic, when we switched many of our services to telemedicine, was actually it was very successful in terms of actually increasing access for many patients because they were able to access our services and stay in contact with us without necessarily having to travel all the way into the hospital. And for a program that really relies on intensive support and contact, that was ideal.
How many people do you expect to be enrolled in this program now that you're going citywide? And what is the average length of programming that you're working with patients on a regular basis and then weaning them off maybe to like check-ins and things like that? Can you explain what that looks like?
Sure. So, honestly, we're trying to serve as many patients as will benefit from our programs. And we're going to be taking patients through a couple of different referral routes. One is through any provider, any healthcare provider at Health and Hospitals can refer an existing patient. We are also we'll be taking referrals from the community. So patients or individuals who are not yet a patient at Health and Hospitals can also self-refer and be screened for clinical eligibility. And what we're hoping to do is really help reduce the chronic disease burden across the city and reduce its complications.
Mr. Mayor,
I have an on-topic question.
on topic, just
Mr. Mayor, I wonder,
in addition to this, what if are you planning to do to increase access to some of these healthier foods? There's so much of the issue in these communities is access, lack of supermarkets, lack of a place where you can get this kind of food, and also the cost burden of buying some of this stuff.
Great question.
How can you increase accessibility, and is there anything you're working on to help people have better access?
Great question. A couple of things. Number one, we're going to do a meal today, vegan chili, $9 to feed a family of 4. And in a few weeks, I'm going to have Rachel put through a program where I'm going to live off of $10 a day by eating a healthy plant-based diet. There's a myth out there that states eating healthy is too expensive. You can take a bag of lentils, which costs around about $2.80. You can make lentil stew, lentil burger. You can make lentil pasta. We want to show New Yorkers not only what happens in the hospitals, but we want to show New Yorkers how you can have culturally sensitive food that is healthy. And that is not what people have shown. And so there needs to be a combination of not only saying when you get sick, you come to the hospital and learn, but I want to use my life and show people how easy it is to have a practical plant-based diet and enjoy your food. Food must look good. It must be good for you, but darn it has to taste good. It has to taste good. And we have not done that. And so the expansion of this is going to be based on how we do a holistic approach of making sure we use the green markets, where people can open green markets, an area where we traditionally are not doing so. Incentivize people by using the food bucks. For every $2 you spend at a green market, we match that. And so we're going to have a holistic approach of encouraging people and incentivizing people on how you could live a healthier lifestyle by making, like you said, accessible. But also, I want people to say, let me walk into my bodega right now as we make this transformation. And what could I eat in my bodega right now? These black-eyed peas are right in your local bodega. The carrots in your local bodega. The bananas, the apples in your local bodega. The berries in your local bodega. So we want to encourage people. My favorite, kidney beans. I make a mean kidney bean stew that I enjoy. That's my go-to meal. The broccoli. So when people think healthier lifestyle, they think they must have this exotic meal. No, these are everyday products that's right in the neighborhood. We need to teach people how to eat better. We gave a woman at a pantry one day, Gloria, we gave her a beet. And she says, what is this? What do I do with this? So it is my job to show her what it is and what she can do with it. How to make beet chips, how to make a beet stew. So we need to now educate people how to look at these products as plentiful around us, but have been ignored.
There's definitely no berries on my bodega, though. I promise you.
Right. And we got to get them there, because you're right. We have to get them there, and what you just said is so important. We have segregated healthy foods from the communities that are the hardest hit with the issues that we're facing. Healthy food is where the New York Times is on the stand. Unhealthy food is where all the other tabloids are on the stand. Hold on, we're going to do it one at a time. We're going to do it one at a time. Y'all know this dance. Y'all know this dance. Y'all know this dance.
Hi, Mr. Mayor.
Hold on. Who did you do? Okay. Yeah, thank you. Okay.
Can you tell me how much this program is going to cost to expand it to throughout the whole hospital system, and just give us a sense of estimated savings when you look at how much it costs to amputate a diabetic leg, or you walk through the Bronx or Queens and it's dialysis center after dialysis center. Can you paint a picture of what the hope is in terms of savings and if you think you can actually realize that?
I just love that question. OMB is we're looking at the numbers of what it costs. I think it costs about $400,000. The dollar amount in Bellevue was about $400,000. OMB is doing an analysis of how much will cost with this new plant that we are rolling out. But you hit on something that's crucial. If I would have followed the path that I was given, I would not be standing here. I was going blind. They said there's nothing they could do for you, Eric. You're going to be blind in a year. That tingling that I ignored, they said you have permanent nerve damage. You're going to lose some fingers and toes. I was going to have to take insulin every day. I was taking medication. They gave me medication for my high blood pressure, medication for my cholesterol problem, several medications for my diabetes. I had an ulcer. They gave me medication for my ulcer. They said, Eric, this is permanent. Add those dollars. This is not sustainable. And so when you look at the fact I did not have to buy that metformin, the insulin, the high blood pressure, the statin, I don't have to get all of those things. So it's not how much it costs for this program, how much it's going to cost us if we don't have this program. And those are just the dollar amounts. The traumatization of my family members. I remember my son when he heard what happened. He says, Dad, you have a BMW. You put the best gas in your car. You didn't put the best food in your body. It's costly not to do this. And so we're going to come up with whatever the numbers are, but we're going to meet those darn numbers because our healthcare system is not sustainable. It's just not sustainable. And I'm not going to allow this to continue in my 4 years in office.
Okay, we have time for one more, and then we're going to cook. Go ahead, Craig.
Thank you, Mr. Mayor. Since you brought up your eating habits, I just want to clarify something. How often do you eat fish, and do you eat any other animal proteins?
I eat a plant-based centered life. Some people want to call me vegan. Vegans eat Oreos, and they drink Coca-Cola. I don't. I eat a plant-based centered life. And those who are the food police for me, they can food police all the time. I eat a plant-based centered life.
So you eat fish?
I eat a plant-based centered life. And I'm not going down that. Hold on. Please don't do that yelling out stuff with me. I don't do it to you. Don't do it to me. I eat a plant-based centered life. And I'm not going down this rabbit hole of what do you eat? If you eat cake and it has eggs in it, that you analyze it. I'm not doing that. The more plant-based you eat, the better and healthier you are. That is my question to those who are following me around in restaurants, wondering what I'm ordering. Listen, I'm not doing that. That's noise to me. I got to get New Yorkers to eat a plant-based centered life. And if that's not an answer that people accept, then it's cool with me.
You described yourself as vegan, and there's vegans who do not eat animal-based protein.
Thank you. I answered the question. I answered you. Do you take another question?
No, we're
Okay.
going to go across the hall, so I'll have the speaker.
Hold on. Before we do that, why don't you folks move out so if there's off-topic questions, because I don't want people to say Eric did not answer my off-topic question. We answered 2 off-topic questions, but y'all don't need to be part of this battling ram.
Go ahead, guys.
Yeah, you We're going to do 2 off-topics, and I got to go make my my chili. Choose your 2.
Mayor, my colleague Melissa Russo reported on the problems in the family court system. I don't know if you saw her report, but one of the things that it showed is that children are waiting 5 times as long for adoptions to be finalized. The court essentially shut down for the majority of the pandemic, and they're not able to get back up to speed. The delays are costing the city money. Families are having a difficult time figuring out child support, custody, all of these things. Do you want the state legislature to create more family court judgeships, or is there anything the city can do to help these families amid this backlog?
This is the first time I'm hearing about that, and we need to look at just saying let's appoint more judges without clearly understanding what is the problem, because we could appoint a lot of judges, but if that's not the problem, then we're going to fail to hit the market. What I do know, I need to get my public defenders back in the courts. I'm hearing that over and over again, that they're not back in the courts. I need them back in the courts. So what I'm going to do, I'm going to reach out to her and find out what is the origin of this, and I'm going to reach out to the chief judge and find out what is the problem and what could we do, because it's not fair for people not to be able to deal with some of those issues that you pointed out. This is the first time I heard about that. I have not heard that complaint before, but I'm going to reach out and find out what exactly is the problem.
I've got two quick ones. Anti-Semitic hate crimes on the rise, but also the story today focused on a building in the Rockaways that has had no hot water for 3 months. There was a judge who said that if it was a private landlord, they would have been fined $500 a day and been jailed. Should NYCHA be held to the same standard as a private landlord, and where is NYCHA on your priorities list?
You're darn right. You know, when I saw that story that was in the paper, that is unacceptable, unacceptable. And this is why I keep talking about NYCHA stat. We should not learn about the dysfunctionality of NYCHA based on a front page story. With NYCHA stat and a dashboard, we should be able to have what items are in a red zone right away. And there was a similar problem out on Rockaway. This should be front and center. And my chief tech officer is looking into building out that NYCHA stat. We want to make sure that I can wake up in the morning, look at a dashboard, and say, what are the problems that we're having, so my team could immediately respond to this. This is unacceptable for people to be without heat and hot water for a long period of time, and we're looking into exactly what's taking place. There's just too much dysfunctional actions that's happening in NYCHA. People have wrote off the NYCHA residents. They're not treating them with the level of respect they deserve. And I am appalled at the thought that you have people living without heat and hot water for that long period of time. It's unacceptable. Okay, thank you very much.